Well, I founded my organization to really meet my own personal need. I was a professor at the University of Pennsylvania, and I was a rising star in the addiction science field. I had been published and surrounded by many others like me. And then my 16-year-old son became addicted, and I did not know what to do. And I repeat, I was an expert. And I realized that there was no place where I could go. I knew the sound fundamental science behind it, but there was nothing I could do to put that science into practice. I didn't know any place that was using any of the evidence that me or my friends had developed. So I thought what we really need is a translational research organization that will be focused on solutions-oriented research that will put science-based findings into practical tools for guys like me when they need it. And that's what we did. The overall goal for TRI is to change in fundamental ways how the public understands and acts upon substance use problems. And we do that in four different ways because we need all four different things to actually achieve that goal. First, we conduct research, the same kind of research that's done in academic settings with the same kind of rigor. But we don't stop there. The second thing we do is we take those findings and we use them to engineer science-based tools that can be used in practical settings. But that's not enough either. The public has to understand and be aware that these exist, so we have an active program to inform the public. And finally, once we've got all those three things together, we try to impact policy at the city, state, and especially federal level. Actually, I think TRI has unique strengths. And that strength derives from our ability to engineer scientific findings into practical solutions for the substance abuse problems. Our team includes experts in research, in policy, in communications, and particularly in business. We now have a long history of collaboration working across sectors to achieve major priorities. I think we have a well-deserved reputation for scientific integrity and excellence. We have been clear in our bipartisanship and our policy objectives, and I think we've been effective in developing tools and solutions that meet the needs of different stakeholders. We've been doing this work now for 22 years, and we're able to draw on a breadth of expertise and a lot of experience to guide that work. I think the core of our effectiveness is research. And most research is purely academic and discovery oriented, the kind you've done in school. And that's important, but that's just the starting point for us. The end game for academic research is just publication of new findings. We start there and we take those findings to build beyond the academic arena into tools and resources that meet the needs of healthcare providers, the families, and the court systems, the schools, and the businesses that all have substance use problems. So we've set high standards for ourselves. We try to have impact in four areas: in research, in creating tools, in communicating, and doing policy. Now, if you're going to be effective in research, you have to publish your findings in respected, high-quality scientific journals, and we do. TRI has published over 500 peer-reviewed articles in the science of addiction. But that's not enough. If your tools are going to be effective and perceived to be effective, then people have to use them. We're proud to say that the tools we've created are used by most of the treatment programs in this country, many of the drug courts in this country, and lots of healthcare organizations. In terms of communication, you have to be able to affect the public. Public has to come to your site and use your information. We are one of the most widely viewed and regularly viewed sites in the substance abuse domain by the public. Finally, in policy, if you're going to have impact in that area, the way to measure it is how many city, state, federal, and international organizations and governments use the policies that you've developed or are informed by it. I think it's fair to say that TRI has informed more policies in more countries and in more areas in this country than any other organization. The Treatment Research Institute is often viewed as just another research institute, like a research center in an academic setting. People are regularly surprised to find how much more we do than just research. I want to be clear that research is our middle name. It is our core and guiding principle. Everything derives from our research findings. But as I've said repeatedly, research is not enough. And I think what sets TRI apart is what we do with our research findings. We do more, and I think we do it better than any other place. Well, I'm proud to say that I think TRI has made some really significant contributions to our field. First, we've created the most widely used patient assessment and monitoring instruments in the world. Next, we developed the first decision support system for judges dealing with substance abusing offenders. They are widely used in over 151 courts in this country. We conducted and published the first research showing that addiction is best conceived of as a chronic medical illness. That finding continues to influence substance abuse policies, treatments, and public understanding in the United States and, in fact, around the world. I think one of the big problems is that addiction got off to a really bad start. It has always been thought of and stigmatized and misunderstood as a sin or a bad habit instead of an illness. What is not well recognized is that substance abuse exists along a continuum. Like every other chronic illness, early intervention improves outcomes, and addiction treatment has historically been based on an acute care model, which is wrong. Imagine if we treated type 2 diabetes the way we treat substance abuse. A person wouldn't even qualify for treatment until they already had gone into diabetic coma or had lost a finger or their eyesight. By the time they'd gotten to the point where they qualified for treatment, the disease would have progressed so significantly that it would have been hard to treat and would have very poor prognosis. But like diabetes, prevention, early intervention, and long-term care management produces excellent outcomes. The public needs to understand this and grapple with this illness in the form that it actually presents. The way we would spend additional resources is to identify areas that had the highest return and the most immediate, broadest benefit. And I can think of two right away. The first is the creation of a standardized course in addiction for physicians, for nurses, and for pharmacists. Such a course does not now exist. Yet healthcare reform is going to demand healthcare professionals begin to treat early cases of substance use disorders as well as more advanced cases of addiction. A standardized course delivered via the internet would go a long way to improving our healthcare quality. The second thing we would do, because the time is right, the science is there, and the need is great, is we would develop a consumer guide for purchasers of substance abuse treatment. Families, insurers, judges, other referral sources. We have the science necessary to evaluate and comparatively display the qualities of existing substance abuse treatments. So those two projects, I think, would have immediate impact, significant return on investment, and most importantly, they can be done. One of the problems in any stigmatized area is that you have so many small organizations working independently and sometimes against each other. That's certainly true in our field. There are many organizations that are trying to impact change, and lots are doing great work, but most are very small. The work is not strategically coordinated. If we could, TRI would like to address this challenge by working with these colleagues and other organizations to coordinate the work that we do, to collaborate, to not be redundant, and to magnify the impact of the work that's already going on. In short, we'd like to create a consortium of leading groups that work synergistically to impact the field and to speak with one voice. Such a unified group could more effectively advance our common objectives and better represent the millions of people who are affected by substance abuse every year.